Marijuana has many medical benefits and minimal side effects and should be legalized by the federal government for all American citizens to use as a medical treatment. Jaden David is a 6-year-old boy who used to suffer from extremely frequent and severe seizures due to a rare form of epilepsy. Jaden and his father both live in California, where medical marijuana is legal. Jaden's suffering was able to be treated with medical marijuana. Within a few days, he had gone from not being able to eat solid food, bathe, or walk, to running, playing, and talking. What if all the patients in America could be treated effectively and efficiently, just like Jaden? Marijuana is a single drug that can solve much suffering over a broad spectrum of medical issues and can help patients as an alternative treatment. However, medication that cannot be beneficial to so many is illegal, therefore cannot be prescribed. Those that use medical marijuana as a necessity are seen as criminals in the eye of the federal government. There is a need for alternative treatment for those who do not respond to conventional medicines, and yet they are not only unavailable but illegal to possess. Criminalization of cannabis restricts the exploitation or appropriate treatment alternatives by patients and violates a right to safety and well-being. All men have certain unreliable rights, such as life, liberty, and the pursuit of happiness, that are not met by the federal government. If there are therapies that can enhance the quality of their lives of patients or even save them are denied. To deny a physician the right to discuss recommended and prescribe marijuana to patients is a direct violation in a physician and patient's relationship. Cannabis has been proven to be beneficial medically in many circumstances, and yet forbidden to those who need it. Medical marijuana is more effective treatment than all conventional treatments. Cannabinoids, chemical compounds produced by cannabis, which affect the body's molecular signals. Marijuana for the medical use has been reported to be beneficial since introduced in 29,000 BC in China and throughout history by many societies. Cannabinoids can help treatment such as AIDS, glaucoma, epilepsy, and cancer. In a patient given to the American Department of Health, a human service states that cannabinoids have been known to be used and help reduce the effects of Alzheimer's, Parkinson's disease, depression, and protects the brain against alcohol poisoning. A prescription drug, which is high dosage rate, in 2010 was responsible for approximately 23,000 deaths. Marijuana has no reported overdoses. Medical marijuana can combat the side effects of existing treatments. According to research done by St. George University in London, some cannabinoids can not only kill cancerous cells and slow their growth, they do not have the unpleasant side effects of chemotherapy or radiation, because they do not affect all rapidly growing cells. A study done by the Institute of Medicine concluded that the benefits of smoking marijuana were limited to the effects of the smoke, but nonetheless recommended that the drug be given under close supervision to patients who do not respond to other therapies. CBD is the non-psychoactive chemical within cannabis, which counteracts THC, the psychoactive compound, and the main medical significant chemical within the plant. Medical cannabis can be administered in a liquid form, so not to be harmful to the lungs, such as the case of Jaden David. Arguments have been made that allowing the use of medical marijuana would increase recreational abuse of a psychoactive substance that is a gateway drug and can lead to the use of harder substances, and therefore should not be legalized. Studies from the Institute of Medicine show that if used marijuana was legalized, it would not increase intellect drug use within the general population, nor would it influence users to continue to harder drugs. In conclusion, there are minimal risks associated with the use of medical marijuana, especially with the availability or alternative forms to be administered. It could easily be regulated to reduce possible abuse, and massive amounts of advantages would outweigh any negative stereotype. Their circumstances would improve from the usage of medical marijuana should be allowed to choose this alternative treatment if needed. Otherwise, they are left helpless to their conditions. Therefore, prescribing cannabis should be legalized for the general welfare of America.